everyone. Welcome to The Obvious. My name is Sonny. I'm the COO of ABC Florida East Coast. I want to welcome you to episode 23 of The Obvious podcast. 23, Peter.
Unbelievable.
Incredible.
The hits keep on rolling. My name's
right.
Peter Daiga. I'm the president and CEO of Associated Builders and Contractors Florida East Coast chapter.
The Obvious podcast is a production of ABC Florida East Coast, unless otherwise stated. All content reflects the opinions of the guests and the hosts, which is us.
And if you like The Obvious podcast, and we assume you do, you can subscribe on all the major podcast platforms such as Apple Podcast, Amazon Music, and Spotify, among others, or watch the audio-visual version on YouTube. You can also follow The Obvious podcast on Instagram, X, and Truth Social. You can always reach out to us via email as well at theobvious@abceastflorida.com. Links to all the social media feeds are in this episode's show notes. And if you want to help others find the podcast, please leave us a review on your podcast platform of choice. So I was stunned, like right before we started taping for this edition, that our producer handed us, or you handed me, some notes from the producer about some of our downloads, likes.
Yeah, we got
referrals,
some great data referrals. We got some
whatever you
great
call it.
data from our YouTube channel. And Mr. Producer was kind enough to share with me some data on our 18 episodes. The data is on 18 episodes, our first 18 episodes. And we've had over 1,000 views on our different channels. 6 episodes were over 100. Interestingly enough, our most popular episode was the one where we deconstructed Bill Maher's deconstruction of the elections. And that video was recommended by YouTube over 800 times, and 5% actually clicked it and watched it.
Amazing. So anyway, good stuff.
yeah.
That's what I mean when I say it, and of course you like it. So subscribe if you haven't. I have, and I like it because the way this works for us is sometimes the taping is before it actually goes live.
Sometimes
some time might pass. So I like to listen to it again and watch it and see all the great work our producers do, making us look good.
Yes.
So
and we have a great team that helps run this show. So anyway, welcome. So Peter, what are we discussing today?
Well, we are going to discuss something that we are so excited about in terms of the impact that this might have on the construction community, ABC's leadership in it, the effort that it took, planning for this and whatnot. And I think demonstrates for me how we're never complacent, right, at ABC, and always trying to ask our members and the industry, what kind of problems do you face that we can help resolve? And what we're going to talk about today is really monumental. I mean, it's like, it's going to be life-changing, I think, for a lot of people. And so we're excited to talk about it and to have a special guest that's part of this partnership. So
yeah, absolutely. We talk about impact all the time, and I think this is going to be one of those initiatives that's going to have tremendous impact for a long, long, long time.
And so ABC Cares and the vision to create it and the direction it's gone in and the things that it's doing is amazing. So we did a previous podcast on ABC Cares that aren't super familiar with it. So we would encourage you to go back and look at episode 9 just to learn a little bit about more about ABC Cares as we talk about it as that.
Back when we were babies, huh?
Yeah, 9, right. So the evolution of the foundation has in and of itself been amazing.
Yes.
To go from not just developing our general endowment and helping construction professionals and their families in need in the local community, but we also have gotten into restricted funds, where because it's a C3 and established and respected and it's got the brand, we can go out there and raise money for, like most recently the LA fires, where we can collect money and we promise 100% of what we collect goes towards that local chapter so
Absolutely.
that they can, But this is taking things a step further. So there's been for some time in the works, how can we, through ABC Cares, impact the mental health and behavioral health challenges in the industry?
Yep.
ABC is playing nationally a large leadership role in terms of suicide prevention as well. And so in any event, we tried to figure out, and we have some exciting news.
Well, before you get into that, let's just make it clear, we didn't have a solution in search of a problem. There was a problem, right? We read a lot of data, even in Europe, that suicides and mental health issues amongst people in the construction industry are certainly above average, and
we know it for a fact.
We know it for
data,
a fact.
Driving that.
Correct.
But there's also, anybody who's been in this business long enough knows, the nature of the work.
Yeah.
The fact that it tend to be in the past a very macho
environment.
So people who tend to not want to seek help.
Yeah.
So ABC's been involved in that national conversation of trying to change that for some time, but the next step is super exciting.
Yes. So we were on a quest for a solution and an actual solution. We didn't want to, as the saying goes, put lipstick on a pig and pretend we had an answer when we really didn't. So long story short, we have an app that has been released. It's called the ABC Cares Mental Health app. The whole idea is to connect those who need mental health with services. So addictions, therapists, psychologists. We're able to do virtual appointments within 24 hours. We're able to do in-person appointments.
That's a key component. This isn't just there obviously are other ways people in this industry have health insurance and EAPs, but I think something that sets this apart is how quickly this can happen. And do we say it anonymously in a sense of a step back from your company,
right? Without having to go through your HR or talking to your supervisor, where you can get care and access to care directly.
Right.
So,
and long term, our hope is being again, ABC Cares being a well established with a record and a brand, and being a 501c3, that I think our long term vision is that QR code, on the sites, that
on the job site,
any subcontractor or a sub of a sub of a sub can click on that, and even if you're uninsured, our future plans are to pursue funding so that we can provide this service for
coverage to anybody, whether you're uninsured, underinsured, fully insured. We want to be able to help everybody, and that's the whole goal of this app, is to be a tool for everybody. So to talk about that, we have a very special guest today. His name is Sam Wilcox. He is the vice president of a company called Harm Reduction Center, which is a mental health service provider. They do inpatient, outpatient. They have locations all over the place, and they were our medical partners. They were the actual providers in this app. And welcome to the show, Sam.
Thank you all very much for having me. Happy to be here.
So, Sam, as you know, we're so excited about the app, but I was wondering if you can tell our audience kind of a little bit about kind of what it does, how it connects you to the care you need. And I've seen a lot of those sort of newfangled, like, come talk to AI and AI is going to help you with your mental health. And how is this different than that?
Well, I'll start off about how you get connected. So the idea is to have QR codes on the job sites, as well as empowering safety officers to be able to hand out sheets and kind of information overviews about the app with the QR code on there. So each employee or each person on the job site would have direct access by scanning the QR code and being brought directly to the sign-in dashboard. Once you click new account, new member, you go through the intake process, which is paperwork that you can fill out right there on your phone, and name.
Now, I'm assuming, Sam, the paperwork is all confidential and HIPAA compliant, and legally all the I's are dotted and the T's are crossed and all of that good stuff.
And I was going to add also that this is we have to have this. So anybody who might be listening, thinking, "Oh, geez, why are you making it so complicated?" But there are certain things and hoops we had to go through, right, Sam? And touch base on that a little bit, if you will, and what Sonny asked.
Yes, any information that you plug in there is not to be shared with anyone, including your employer, loved ones, doesn't matter. If you don't sign a release for it, we cannot share it with anyone. So the information that you plug in of your health history, who you are, all the questions that go on about what you're looking for, services, things like that, that all stays with us and only us. And we are not allowed legally to discuss that with anyone. So as you fill all that out and get that plugged into the system, you're given a username and a password where you can sign in, and you're brought straight to the dashboard. On that dashboard, you can create appointments. You can, after you've been with us, see your appointment records, can see your medical chart, can see your prescriptions, any of those things, and see what your schedule is as well for upcoming appointments or medication refills and things of that nature. Now, it's important also to note that throughout the different pages in the app, there's a phone number on there that takes you directly to our hotline, our admissions line, if you will. So that if you're having any questions, you're having any issues, anything of that nature, you will be brought to someone who can help you troubleshoot that, or that worst case scenario, just make an appointment with you right there on the phone.
And the appointments,
So the goal,
you're talking about can be either virtual or in person, right? And we're not talking AI stuff, to Sonny's point earlier, where a lot of direction, that a lot of companies are going in is, asking you those silly questions.
Yeah, like talk to
this
AI,
is real. This is real, person to person, either virtually or if you want to be, sitting across from them,
face to face.
Those are the options we're talking about. Correct.
correct. This is strictly human interaction, so no AI. I have my own feelings about that, but long story short, we want to develop a connection with the employee or whoever is on the platform, the client. So no, you will be directed straight to a call or you up for in-person, telehealth in person, either one. And we have different locations throughout South Florida, so that to make it easier for travel and getting folks there and things of that nature. So we're very, very excited about that piece. Our goal, remember, I'll always repeat this, is to make it as easy as possible for a person to access care. Remove all the barriers in between, and that is making it simple, easy, and affordable.
And timely, again, one of the things that sets us apart, right?
Yeah, exactly.
Yeah. Because
it's funny you bring that up, Peter. We had speaking to a representative a couple days ago, and who is a representative that does oversee some of the healthcare space in Florida. And this individual was talking about looking at scheduling therapy appointments, even with her insurance and going through her EAB. It took her a month and a half to get an appointment set up.
Wow.
Now, a lot can happen in a month and a half for someone suffering a crisis,
right,
or any type of mental health issues for that matter. That goes without saying. So like you said, Peter, that timeliness of us being able to, within 48 hours, get you with the provider, I don't think there's really a comparison. And I think that's what really sets us apart than your calling the back of the insurance card, going through an EAP, or going through your HR. There's going to be lag time, and things can happen in the lag time.
Right. What a great product. And Sam, we're obviously appreciative of our partnership.
Talk about how, this has been a long project, right, Sam? Can you think about way back when the glimmer in somebody's eyes? And by the way, I want to mention, we had many of the people who support ABC Cares Foundation have helped in some way or another the belief in it, the support of it, but we also had a special contribution that was earmarked or restricted, if you will, for development of this app from our past chairman of the board, Annie Macias Murphy, with JA&M Development Corporation. So she believes so much in this that their company helped seed part of the cost, because developing this is we're breaking ground in many ways, in not only what we're doing but how we're doing it. So in any event, I wanted to give a thanks to her. This is happening. So, but if you can go back to if you can remember, when we first started talking about this possibility and the vision for it, so people can get a feel for exactly how much thought and preparation has gone into this.
I would say it's over a year ago now at this point. I remember sitting with you, Sonny, and Peter, and this just kind of being an idea that came from you all internally as you educated us on the mental health struggles of the construction industry, being one of the leaders, if not the leader, in the number of suicides per year, industry-wise. And from that moment, we had many working sessions, a lot of phone calls. I personally spent a lot of time with contractors, going to the job site, learning from you, Peter, from you, Sonny, from all of our members, our board, understanding the culture that is construction. And I believe that a lot of thought went into the app on how we can best broach the gap between mental health and the construction industry. This wasn't just a copy and paste, throw it on paper, and we hope it works out, and we'll tweak it as we go. No, I believe, we did a very good job collaborating internally, just from, appropriate paperwork and lawyers and
one of the things I do want to bring up, Sam, that came about during those countless work sessions we had and planning and spitballing ideas was the idea that we wanted to make sure all of these resources were available in Spanish. So if you can briefly kind of talk about that and how we have solutions, and you have therapists that are fluent in Spanish, and we have actual mental health that can be delivered in Spanish.
That's correct. We made it a point to have our professionals to at least have one in each track that is fluent Spanish speaking, so that no matter what you come in, whether it's English, Spanish, whatever the case may be, the treatment stays
consistent,
stays the same for both languages, which I'm pretty proud of. And being able to now, we've already done this, Sonny, as you know, but showing up to job sites and giving mental health talks in Spanish, just so that everybody out there can understand it English as well. But my point is we put a lot of thought into making sure that this gets across to everyone out there, not just the folks that speak English.
What specifically in the app, talk a little bit about the suicide prevention and how we might be able to provide either a number or some help in regards to that, somebody that's in a...
Yes, within the app, there's on multiple pages, it's if you are currently having suicidal ideations, you call this number direct. And from that point on, you're connected to an individual that they're going to assess where you're at. And if, God forbid, it's that time and you're close to wanting to make a decision like that, the proper authorities will be dispersed so that you can get to a safe place, or you'll be directed to your nearest Baker Act receiving facility so you can go and voluntarily check yourself in and get the stabilization you need. Now, the good thing about that is we are affiliate partners with HCA, Hospital Corporations of America, and they have the largest hospital network in Florida. So no matter where you are geographically, we will be able to give you, I think, the best directives on where to go as quick as possible, as opposed to some more limited networks, if you will.
Well, Sam, we're so excited about this app. We're so excited about the opportunity to offer this service to our industry and then to grow it beyond our industry and to offer it to the uninsured and the underinsured. So we're very excited. We're grateful for our partnership. As we kind of finish up, it's just another arena
phenomenal
in which ABC is leading.
Yeah, it's phenomenal where the CARES and this partnership is going to take us, I think, in terms of serving the industry and the people that make the industry happen day in and day out.
So literally the people who build America.
That's right. That's right.
And those are the people we want to take care of.
Very excited. We're excited for the people that saw the vision, that supported us. It's been a long time because there's a lot of complexities in what we're doing. So, but
if this was an easy solution, everybody would be doing it.
Exactly. Right? So anyway.
Well, one thing I did want to touch on real quick is the work that we've done in DC as well, Sonny, where we have met with several of our elected officials to let them know that a lot of times, especially in the construction industry, not everybody is insured and not everybody has access to health benefits. So one of the things that we're going to be broaching together is, Peter, you touched on it earlier, is going for funds, state and federally, to support working class folks, because a lot of times everybody assumes, oh, well, you have a job, you have insurance. That's just not the case.
Right.
So I think it was amazing that ABC had the foresight to say, hey, I think we need to go out there and create a fund in order to support our working class Americans to make sure that they can stay healthy and happy and take care of their families.
And ABC Cares being a 501c3, I think we've gotten a much warmer reception with, and there's a lot of money appropriated because their policymakers understand this is a problem in America and they want to provide some solutions. And it's not just because, and it may be that a sub of a sub of a sub is just not offering insurance, but sometimes people decline insurance, right? But we don't want anybody on a site, and that's our ultimate goal, to be able to click on that and get the kind of behavioral health or mental health services that they need. So,
well, we're grateful for your time, Sam. Thank you for joining us. And we are certainly appreciative of you for watching. Thank you for listening and honoring us with your time. We look forward to sharing another episode with you really soon. And if you have any questions about anything in terms of mental health, there's a phone number on the screen. If you need some help, the suicide prevention hotline number is also on the screen. If you need some help, please reach out and get the help you need.
And if you're interested or want to inquire, about information about the app, certainly reach out to any of us at ABC. Anybody you know here will get you in contact with the right person.
And you can always email us as well.
That's right. So thank you, Sam.
Thanks, Sam.
Thank you, gentlemen.
All right.
I appreciate you both.
Thank you.
Take care.
So thank you all for listening and honoring us with your time today. We look forward to sharing another episode with you very soon.
Thank you. Have a great day.
Ciao.